Okay. Remember, mode of transmission is respiratory droplets. The presentation, I told you guys about the presentation. Pay attention to lymphadenopathy, the rash, plus the fever, high fever. This is the rash, the rubella rash, starting all over. It's all over. Okay, any questions so far? Okay. Next one is called fifth disease, also known as erythema infectiosum, which is known as fifth disease. Okay, this is caused by parvo B19 virus. Parvo B19 virus, and parvo B19 virus is a single-stranded DNA virus, single-stranded naked DNA virus. Okay, single-stranded naked DNA virus. The presentation of fifth disease is that the patients will have a typical slapped, what we call slapped cheek fever, okay, slapped cheek fever, because the rash will appear on the cheeks and it will look like a lacy reticular rash, like a mottled skin, okay. When the rash appears, that the patient is not infective. That means they're no longer infective. Okay. Um, let's see. I want you guys to know something important about parvo B19 virus. Parvo B19 virus, if this infects a patient who has sickle cell anemia, in sickle cell anemia, it will cause what we call aplastic anemia, which means it will destroy all the erythroid progenital cells in the bone marrow, leading to aplastic anemia. Okay. So it can affect, it can target the bone marrow, especially in patients who have cell anemia. Okay, plastic anemia, very important. I always ask that question.
The fifth disease, is that kind of like the parvo that's found in animals?
Again?
The parvo, is that it's kind of like the same parvo that's found in like animals, like in commonly in dogs, or is this two different
Parvo
kind of parvo?
B19 virus?
Uh-huh.
I don't know. I don't know. I'm not sure. I have no idea.
Okay.
Maybe it affects dogs. I'm not sure. I'm not sure.
Uh-huh.
Okay, so other important things to associate. So slap, as we said, slap cheek. Okay, slap cheek appearance. This a lot of times in the doctor's office, the doctor gets suspicious sometimes for child abuse because of the way the appearance of this rash, the way it looks. So it can be confused with that a lot of times. Can also present as a papular pruritic glove and sock syndrome, which means that the rash affects the hands and the feet. In some patients, it can cause arthritis or arthralgia. Arthralgia means joint pain. And as we said, in sickle cell anemia patients, it can cause aplastic anemia. Okay. So this one is going to be more commonly found in adolescent population. infection. And this is the slapped cheek appearance of Fifth's disease. And this is the reticular rash that appears. This is the, again, slapped cheek appearance typical of erythema infectiosum, known as Fifth's disease. The other one is roseola infantum. This is caused by human herpes virus 6, human herpes virus 6, which is a DNA virus. The mode of transmission is by oral secretions. Okay. The presentations is that the infants, they will have a high fever for about 3 days, and then this is followed by a rose pink rash. First, high fever for 3 days, followed by a rose pink rash. Okay. DNA virus is a double-stranded circular naked DNA virus. And this is the rash that is typical, usually on the back or the chest. This table is basically a summary of all of these exanthems of the childhood. Any questions on these? No?
Yes, sir.